Barnet Hospital is what it calls full up to the front door. That means some patients having to wait in ambulances because there isn't room inside. Patients like Ray, who's hurt his coccyx in a fall.
How long have you been waiting in the ambulance for?
I probably think maybe an hour. I mean, it is frustrating because I want to go in there.
Yesterday was very busy. 42 people waiting for beds.
42 people
in
waiting?
A&E, waiting for beds in the morning, which means people like poor Raymond here get stuck outside.
Yeah.
And then we're having to treat people in the ambulance. It's not fair. He's in a lot of pain, and all we've got is gas and air at the moment for him.
It must be frustrating for you to not be able to offer the service you'd like to.
Very frustrating, yeah.
As we talk, another ambulance arrives. And if these vehicles can't offload quickly, they're not available for further call-outs.
You might have 5 or 6 ambulances waiting 60 minutes or longer, and cumulatively that time across London is ginormous. And the worry is around the uncertain risk of that patient has dialed 999 or somebody's dialed 999 and that ambulance cannot get to them in a timely way.
We've got a huge demand for beds at the moment.
So how to ease the pressure? The adult assessment unit next to A&E is usually short stay, but is adapting into a ward to create more bed space.
These are the pressure mattresses that we need for our patients. So I've just been to the site team and escalated the fact is that we need another 9 pressure mattresses.
This isn't normally a ward.
No, this is not. This is AAU. So AAU is an assessment unit.
So some people are having to stay here essentially because you haven't got anywhere else to put them?
Well, yes. Yes.
Yeah.
There's not just a shortage of beds, but also staff. Nationally, NHS absences have gone up nearly 60% in a week, and it's the same here in the emergency department.
We've had another doctor calling in sick for next week already. We're pretty much hemorrhaging doctors every day. And next week, basically, we're down to 3 night doctors, as it stands, out of 7, which is going to be rather difficult.
There's 3 out of 7 doctors.
The emergency department has been just overloaded with patients. We've had no exit flow through to the wards upstairs, with ambulances having to queue outside. Over the past few days, we've had waits of up to 8 hours, 9 hours to see a doctor, especially at night time.
77-year-old Alan has been admitted with a heart condition. He should be on a ward, but after 20 hours, he's still in A&E. And he blames people who've not been vaccinated taking up space.
What they don't understand is that it isn't just a question of protecting themselves. They're being selfish because they're taking up beds that need not be taken up. And that is putting more pressure on the health service.
Here on the COVID wards, they say a few months ago they had many serious unvaccinated young people with the Delta variant. Now there are more elderly vaccinated people with Omicron.
Our ward is a 35-bedded ward, which was purpose-built during the pandemic to look after patients with COVID. Currently, our ward is full, and it's full with all patients with COVID.
Omicron symptoms seem milder, but people are still getting dangerously ill. 38-year-old Julia Alley, who twice booked and then cancelled her vaccination, contracted COVID at a Christmas party.
I'm okay, I'll just catch my breath back.
I understand you haven't had the vaccine, is that right?
That's correct, yes.
Yeah. Why didn't you take the vaccine?
With all those social media controversy, so that kind of made me think, is it right or is it wrong?
Yeah.
It's the biggest regret. I should have listened to all my family and friends, because everybody else has had it. It's just me.
Did you feel like you were going to die?
I did.
It must have been terrifying.
Before I even got here at home, when the ambulance came up, I was on my last breath. My oxygen was below 70.
Yeah.
So I was quite close to death.
COVID impacts everything. In the geriatric ward, some patients can't leave because of staff shortages in social care, or some can't be discharged because one person on their ward tested positive.
What it means is that this bay is now shut probably for the next 2 weeks while we wait for the remaining patients to go through a period of isolation.
Yeah.
We can't admit any new patients into this bay until it's been cleared, cleaned and is ready to receive patients again.
One of those who would otherwise be discharged is Keith Mackenzie, who just wants to get home.
I'm sort of kind of stuck in a nightmare, if you like. Yeah.
And that perhaps sums up the NHS right now, a series of bottlenecks, with some patients unwillingly stuck here and others held up from even getting through the door. Jason Farrell, Sky News.